Hello and welcome. Over 24 million doses of vaccines against COVID-19 have been administered across India at this point, and we are approaching or almost hit almost 2 million doses a day now. Now, that 2 million also includes, remember, both the first and the second dose. Now, COVID-19 vaccine prices have been capped at about 250 per dose in private hospitals in India. Of this 250 rupees, private hospitals get about 100 rupees as a service charge, while 150 rupees goes to the vaccine company. Now, Kiran Mazumdar-Shaw, the founder of Biocon, a leading pharmaceutical and biotechnology company, said on Twitter that vaccine companies feel betrayed as the price is too low to sustain. We are crushing instead of incentivizing the vaccine industry. Earlier, on January 12th, Adar Poonawalla of the Serum Institute of India, which is manufacturing the bulk of vaccines, said that it is manufacturing Covishield and that once the vaccine enters the market, the private market, it would cost around 1,000 rupees. Now, it is not in the private market right now. Meanwhile, citizens living in Israel, the United States, the United Kingdom, Australia, and many countries in the European Union are getting vaccinated for free. So this brings us to the larger question. Should vaccine prices be raised in order to ensure quicker and faster distribution, particularly to those who can afford it? Should they be raised at all? Should they be free, though it is not right now in India? Or more importantly, how should it be priced in a manner that there is enough incentive right and up and down the supply chain, and also to ensure that enough people get vaccinated so as to achieve the larger objective of herd immunity and therefore return to a normal life. So to discuss that, I'm joined now by Dr. Ajay Shah, economist and professor at the Jindal Global University, who has written on this subject, but also has been speaking and or writing on price controls in general across markets, but in this case in vaccines. Ajay, thank you very much for joining us.
Thanks, Govind. It's great to be here.
Right. So, so your argument, Ajay, is that basically the tenet of economic policy is that price controls work poorly. If price limits are brought in, that will limit private outreach to cities. And if we want to, on the flip side, expand the reach of the vaccine, we should obviously open it up. What is, from your own vantage point, what are the pluses and minuses of doing that?
So, as you said a moment ago, the key insight is that India is very diverse, and we are a large country. There's 3.3 million square kilometers. It is difficult to operate in many parts of the country in terms of ensuring a cold chain, in terms of getting trained people out there in order to do the vaccinations. And that's a real cost. So if a private person is going to buy a vaccine, if a private person is going to make a vaccine, if a private person is going to operate the cold chain, and the private person is going to go to remote places and do vaccination, this has a cost. Now, nobody is arguing against the government when the government says, I will do some amount of vaccination for free. Great, more power to you. Okay? So if the government wants to organize camps all around the country where they will do vaccination for free, by all means, they should do so. But many people, and including myself, have argued that the government should not limit the ability of private persons to do this business. So if some healthcare organization wishes to import a vaccine and give vaccinations in India at a price of 10,000 rupees, they should be free to do so. Okay, there's no harm. Some private person is paying for it, and every one person in India who gets vaccinated protects everybody else because the disease transmission goes down. So if somebody is willing to pay from their own pocket, how do we gain when a government comes in the middle and says, no, I will control the price at which this transaction will take place? Okay, and we are reducing the gains to society. The more people that get vaccinated, the better it is. The disease burden comes down. The more people that get vaccinated, the more those individuals will go out and live a social life, an economic life that will restore normalcy in the country, which is a great thing. So I just feel that the costs and benefits don't add up, and you're much better off having an unregulated environment. And particularly, we should see the contrast between the cost structure in a building in the cities as opposed to in a more remote location. So imagine I am some healthcare company, and I come to your building, and in your building you are able to organize 100 people who will get vaccinated and will generate, 100 multiplied by 500 rupees per person. There's a decent revenue stream there. But when you want to go to more outlying places, mobilizing 100 people is harder. So effectively, a price control limits private sector vaccination to buildings in cities.
Right. Now, this could apply in many cases and different kinds of markets. But in the case of COVID-19 vaccines, almost all countries seem to be following a similar or if not identical government-administered rollout system or distribution system. So what would you say to that?
I would say two things. The first is that you have to locate this in the dimension of state capacity. So in how many days do you believe that a substantial proportion of the population will be completed? And that's where the statistics that you started at become so important. If we are at 2 million doses a day, then in 500 days, we'll do 1 billion people one dose. In 1,000 days, we'll do 1 billion people two doses. Okay, are we satisfied that it's going to take 1,000 days to cover 1 billion people, and I'm not going to the full population of the country? Or do you wish to go faster? So, if you're Australia, it's a small country, it's basically the population of Bombay, and the government system is highly capable, and within a matter of 2 months, they'll cover the whole country. Great, that system works, but we are not there. We should look at our conditions and we should solve our problems. So, never mind what other people are doing. We should look at our Indian reality. So, do you believe we can get up to 20 million doses a day in the government system? Great, then this discussion would be moot. Because then in 100 days, we'll get to 2 doses for 1 billion people.
But how will price lifting of price controls or not capping prices change that and change that in this period of time that we're looking at?
So the proposition I would offer is that there are people all over the country who crave the vaccine. Okay, so there are older people, there are people with comorbidities, there are people with immunological problems, and there is keenness to get the vaccine. We can debate whether it's 1 million people or it's 10 million people or it's 100 million people. But there are people out there who are keen to get the vaccine. And at present, they're just waiting. There's a government system that is not giving them the vaccine. So it seems to me there is demand for the vaccine. Now let market forces work. I have no preconception. Maybe a private person will say that in Jabalpur, for me to do the vaccinations, I'll end up charging 5,000 rupees per dose. And maybe at 5,000 rupees per dose, there is no demand. I don't know the answer. I don't pretend to be a central planner. I don't have a recipe for what the answer will be. But the point is, why should the government interfere with that process? That's all I'm saying. That let markets work it out. This is what private firms do. They figure out, is there a customer? Can I make money getting this to them?
Right. No, but in this specific case, Ajay, since that's what people are concerned about. If we say that, let's say from 250 rupees, we do go to 1,000 rupees, the number that Adar Poonawala referred to, though in a slightly different context. Now, if you do go to 1,000, what happens? I mean, what's the downstream effect that you see of price going up or the opportunity to charge that higher price?
So I see many things going on in the dynamics. The first is we should note that Serum Institute is not the only game in town. We can import vaccines. So the Pfizer vaccine can be imported. For some reason, the government blocked the import of the Pfizer vaccine into India. Okay, the Johnson & Johnson vaccine can be imported, and so on. There are numerous vaccines coming up all over the world, and all of them should be used in India. So, we should have an approval system saying that if any OECD country has approved a vaccine, it should be fair game for importing it into India and using it on a large scale. All over the world, there is a giant ramp up of vaccine manufacturing that is going on. And there will be many, many price points at which various people in India will try to obtain certain vaccines. So we don't know the answer. I'm just saying, I don't know the answer. You don't know the answer. No civil servant knows the answer. You have to let markets work out, and they will discover at what prices which vaccines are available. Then there's the question of the cold chain. What is the temperature that is required? The Pfizer vaccine requires more careful cold chain through which you get the vaccine out there. The Serum Institute AstraZeneca vaccine is less finicky in terms of cold chain. Here is one novel idea. Okay, the Johnson & Johnson vaccine is 1 dose, not 2 doses. Okay, now maybe there are remote locations in India where from an organizational and an operational perspective, it's actually easier to just go to a remote place, deliver one shot, and come back. So, in principle, you'd be willing to pay 2x the money for that one dose of the vaccine because it greatly reduces your logistics costs. I'm just saying that private people will discover what to do.
Right. So, of course, in this specific case, therefore, you're arguing for both things. You're saying that one is free up the prices and secondly, free up imports.
Yes. I'm just saying let markets work. Markets do these things. There are customers who want a vaccine. There are producers who want to sell a vaccine. There are numerous healthcare firms in India who have customers. So, many employers will sign a bulk contract with a healthcare firm saying, you please vaccinate all of my employees and their family members. You can't predict how these things go. I just want to say, let's not be a central planner. Let's not try to have a government that's driving this whole thing.
Right. So the other concern, Ajay, is, and it would be interesting to know how you think about this, is the timing and the time period, right? So let's say we are talking about the next 500 days or 600 days. Now, obviously, at this point of time, the approach that we've taken as a country is to vaccinate those who are older, let's say 60 plus. Those between 45 and 60 with comorbidities, and as I understand, the next phase, which should start in about maybe 4 or 5 weeks, could be that we go to 50 to 60. Now, the thing is that if you were to bring in, let's say, free pricing or some other kind of freedom, won't then the people who should be getting it in the beginning or at start be deprived of it and deprived of the public health approach of vaccinating sequentially and chronologically by age and so on?
So I'd like to respond in two parts. First, nobody is saying that we should scale back the government system. Okay, by all means, more power to you. Please go vaccinate more people. I'm only saying, please give freedom to private people to pay for something from their own pocket and get it. Okay, for an analogy, let the government run more schools. Don't ban private schools. Okay, that's the kind of thing I'm saying. That let private people do their thing. Now, I do not believe that anybody has an accurate understanding of what is this order in which people should be vaccinated. No central planner knows the correct answer. Let me give you an example. Each person has a different age, has a different life design. Maybe I have more contact with people. Maybe I have less contact with people. Maybe I'm a teacher and I interact with more students. I have high contact. Should I get the vaccine at a higher priority? Should I get the vaccine at a low priority? No central planner knows the correct answer. So let's not be so lofty about some central planner knowing everything, the correct answer for the whole country. People have their own threat perception. We all have a livelihood, a social life. Maybe you go meet more people in your friends and family. Maybe I'm more of a recluse. I'll sit at home. Based on our threat perception, we will each determine what is my willingness to pay. This is called market economics. We do this in everything. We should do that here as well.
Right. So now, if you were to look at medicine in general and maybe previous pandemics or previous epidemics, would you say that the approach of opening up prices or not having price controls has worked elsewhere, including if you look at epidemics like AIDS?
No, we really never had this kind of situation before. So as an example, when the smallpox campaign was done in India, there was zero private sector. Okay? It was entirely a government-led mobilization. And again, I just wish to reiterate, let's be pragmatic. Let's get things done. So, if the government system was able to cover 1 billion people in 100 days, there's nothing to talk about. Great, we are done. But the thing is, that's not where we are. We are at 1.5 to 2 million doses a day. By the way, I would say under a certain distribution model where we're using certain large facilities and covering certain catchments. There are large parts of the country that are not being touched by the government's vaccination system. All I'm saying is every one additional person who is vaccinated is a pure win for society. So why should the government come in the way of telling a healthcare firm that you have a customer, but I will prevent you from doing a vaccination? As I said, the analogy is the government runs schools, great, please run schools, but don't ban private people from running schools.
Right. Last question, Ajay. So if I've asked you this earlier, and you've also looked at seroprevalence studies. Now, and you did say that it was your belief that the disease has swept through the country, if I remember the words that you used. What's your sense now? I mean, at the pace that we're going, whether or not we have stepped up distribution, where could we reach, and where would those two lines intersect? Those being vaccinated and those who are already immune or resistant because of seroprevalence.
Yeah, so it's become a little complicated. In some ideal world, we would have ample seroprevalence studies. We would be able to classify various bins of the population. That if you are a school teacher of age 40, then here's the likelihood that you have the antibodies, and here is the advice about whether you should take the vaccine or not. We don't have those studies, so which is again why we should have a more organic, decentralized, market-based approach. It seems to me that in each neighborhood, in each community, there will be a threat perception that are people falling sick, are people not falling sick, and the seroprevalence numbers are varying all across the country. So in places where the disease is still active, more people will take the trouble and will step forward and get vaccinated, and a market-based system will understand that, whereas a government-based system tends to be like a fixed drill, a fixed program. We all get marching orders, we obey. It tends to not be so flexible and responsive to local conditions.
Right, and a question that I wanted to ask you earlier, when you advocate for freeing price controls and imports in some ways, you're also implicitly or explicitly placing your trust in the private sector's ability to deliver. And deliver in every sense, right? Manufacture good quality, ensure its distribution, ensure that no one gets, either gypped or cheated along the way. I mean, are you sure about that? Because that's, I guess, one of the reasons why governments, including in India, are wary of handing out too much and too soon to the private sector.
So I would like to respond in two parts. The first is that at every step of the COVID-19 story, actually the private sector has done reasonably well. The private sector massively scaled up the production of PPE. Ultimately, it was the private sector that scaled out the testing, okay, and so on. So the Indian private healthcare sector has considerable capabilities, and this is no different. This is actually not a complicated thing to do. You buy the vaccine, keep the cold chain, and administer the shots. It's not complicated. There's no reason why the private sector will particularly fumble in doing that. And the second is, we should not assume that the government is so perfect in doing these things. We have ample evidence that the immunization programs run by the government don't work so well. The immunization coverage of the government system is quite poor. We do not know that the cold chain as managed by the government works perfectly. So I think there are flaws on both sides, and we live in a country where both the private system and the public system work reasonably badly. But on balance, if you think that about 20% of all vaccines in India are duds, the answer still comes back that please go get 1.2 billion people vaccinated, so that out of them 1 billion will be not duds, and then we'll be pretty much done with this epidemic.
Dr. Ajay Shah, now professor at Jindal Global University. Thank you so much for joining me.
Thanks, Govind.